Health officials and global leaders are urging Indian Prime Minister Modi to enact a nationwide lockdown as newly confirmed cases of coronavirus surge across his country. India is now averaging nearly 400,000 new cases every day. The country recorded its highest single-day death toll Friday since the start of the pandemic. More than 4,000 recorded deaths nationwide. For more on this, CBS News foreign correspondent Chris Livesay joins us now from New Delhi. Chris, since you've been reporting on the ground in New Delhi, you have shown us such heartbreaking images. Tell us what you are seeing there now, and are you seeing any indication of progress?
Well, Lana, let me tell you what I'm seeing right now. I'm on a street that would otherwise be bustling. It's a Saturday night in the middle of New Delhi. There would be street vendors. There would be people out getting food. You see none of that right now because there is a lockdown here in New Delhi. However, one epidemiologist tells me that the virus is already so rampant here that it's probably too late for a lockdown to do any good. What he's advocating is that the hinterland, the rural parts of the country, where we have no idea how far the virus is spreading, that's where we need to be imposing a lockdown right now. How did we get here? Well, let me tell you some of the things that we've seen. Some of the most heartbreaking images have been those cremations, some of them in makeshift open-air crematories like a parking lot because there's simply no more room inside of the traditional crematories. So we've seen people being ushered into these crematoriums over and over again. They're being run 24/7 right now. Some of the furnaces have actually started to melt down. These are iron furnaces, and they can no longer contain the heat. That's how rapidly and how consistently these furnaces have been burning. Hospitals are also a dreadful scene. A lot of hospitals no longer have room in them. They're having to turn patients away. And because hospitals are collapsing, patients are having to seek help in charities. We went to a Sikh temple, for instance, where they're giving people oxygen, but only in brief sips. That's because there's a shortage throughout this entire country. And finally, the vaccine is also very hard to come by. We saw people lining up outside vaccination centers, but there simply isn't enough to vaccinate all 1.4 billion people in this country fast enough. At the current rate, which is only about 3% of the country that's been fully vaccinated, it'll take another year and a half, possibly 2 years, to vaccinate everybody here. So the conditions continue to worsen. This is now the third day in a row where we've had more than 400,000 new cases, and there's no sign of it getting any better. Lana?
Chris, I have to say, those images of those parking lot fires, knowing that those were makeshift crematoriums, it's just so stunning. You've done tremendous reporting out there. Are there any signs, before I let you go, of what the Indian government intends to do next in order to deal with this outbreak?
Well, there's a growing chorus of people demanding that the government impose a national lockdown. So as I mentioned, cities like New Delhi are already locked down, but the entire country is not. That's because the approach here has been to delegate those types of decisions to the local level, whereas on the national level, they haven't imposed a lockdown. And the government is very loath to do that because of the economic impact it would have on the country. But so far, it's already had devastating consequences without a lockdown. In fact, the U.S. Chamber of Commerce worries that it's going to eventually have a global impact because this is the 7th largest economy in the world. And if this keeps up, we're going to start feeling it everywhere, even in the United States.
Global ramifications for sure. Chris, thank you.
Thank you.